I am Dr. M. Gopichand. I'm a urologist and andrologist in KIMS Hospital, and I've been in this city for last 10 years practicing urology and andrology. I'm well trained and academically oriented and into a lot of surgeries, which includes the most modern surgery, that is robotic urology and minimally invasive urology, uro-oncology. Uh, Today, this particular 5 minutes talk is very close to my heart, and this is just not a kind of advertisement, but it's a kind of thinking that we have to change, that I have been thinking for last few years. It's about men's health. You'd be surprised to know, or you all must be knowing, what is it, what is men's health. Now this dates back to around 10 to 15 years, wherein not much of concentration was done into this segment. You have gynecologists, a specialist for women, pediatricians, specialist for children, but for men there are not any sub specialization who really concentrate in it. The other thing that is very important in men's health is that we as men, uh, we really lack in few things, and the first and foremost is that world over, in any society you take, the life expectancy. The life expectancy of men has always been less than that of women. Even in the most modern society like USA and Europe, men live less than women. They live the average life expectancy has been just 5 years less than women. Men suffer more in terms of diseases from the childhood to the old age. This is a very ironical thing. In middle age, especially in the young adult, the time when we should be very up and fit, we are more susceptible to diseases like hypertension, diabetes, and all stress related diseases. And this is where again we have outscored women. In childhood, the congenital anomalies are more, again you have outscored women, or the boys have outscored girls in the kind of diseases. And in old age, you live less than them. You have more. We have more health problems, be it urinary health problems, be it problems because of cardiac illness. You score at every point. You will realize that you are more unhealthy than your partner, than your life partner. Now, this is again a very ironical thing, that because of this, your whole productivity is down less than a woman. Now, this talk is not only to make ourselves aware of this situation, but also to come up with steps to overcome and at least become a little more healthier and be competitive to your partner, to women. At least now we have 5 years down, at least let us try and make it 2 years or 3 years less than that of female. Genetically they live longer, definitely, but the kind of change in the habits would really make us live more. Now, I as a urologist and a men's health specialist would come up with few points. The one and foremost is that I like to appeal the women of your life, means the women also, to encourage the men, their husbands, their sons, their daughters, their fathers, to come and get themselves checked up. Most of the time it is not like this. So it is most of the time the men would neglect. They feel they are much more stronger, but in reality it is not. So it is necessary for us to encourage them to go and be aware of their health. Now, there are at different points of time different kinds of problem, especially in the middle age. Erectile dysfunction is one problem which is quite common, and it is just not a disease, but it is an indicator of bad health, of poor health. It is a point of contact with the doctor. It is just an indicator that you may be having other problems also, like atherosclerosis, like cardiac problems, and it is just an indicator. Do not take this as just a disease. So, this is one thing which can make a small change. Then apart from this, one must get their blood pressure examined, their lipid profile examined. There is a connection between erectile dysfunction, hypertension, lipid profile, diabetes, metabolic X syndrome. All these are well connected with each other, and it gives me a chance, to educate men to come out of this cycle, change their habits, and I would like to try and do something so that their life expectancy would increase. We at KIMS Hospital run this specialized urology clinic, which look into all these things. It is a whole treatment of the men that we like to see the complete treatment, just not look at the single disease, but we would like to see the other things also as far as men is concerned. And this is just a beginning, and I think with this small beginning, at least we can try and make a difference in our society per se.